Hey friends! So most people know that 2 years ago I had open heart surgery to have a valve replacement in 2018, or you would have seen the big scar maybe in the middle of my chest. So that surgery and the recovery was one of the hardest things I've ever been through and one of the most painful. And I guess the reason I'm making this video is because on Monday this week I went to my cardiologist and found out that I would be having to have open heart surgery again in potentially the next month or so. Last time I didn't really share much about my surgery. I shared a little bit, but not really the day-to-day recovery, and it was really difficult. So this time I've decided that I'm going to share my recovery step by step, and I guess, the individual, the smaller surgeries leading up in the next month, not only to help myself mentally kind of cope with it and see how far I've come in the recovery, but also anybody else who might be struggling with health issues and have no one to talk to, or mental health issues or anything like that. So I wanted to explain a little bit about my actual heart problems. So I was born with, in short term, a bad heart valve, so a bad aortic valve. And when I was 5 days old, as a baby, I had it blown up through open heart surgery through my back. So I have a scar that goes from like up here to down here. The scar's kind of faded now that I'm older, so you can't really see it. But basically I always knew I would have to have a valve replacement. So in 2018 I had a valve replacement, and honestly the surgery was the stuff of nightmares. I'll include some photos of the actual surgery and a screen grab of my recollection of it after the surgery from Facebook in 2018. So when you have open heart surgery, they saw your sternum open and they break your ribs, and then they put you on a bypass machine to keep you alive and keep your heart going while you're having surgery. So my surgery was meant to take 5 hours and it ended up taking 12. They couldn't get my heart started again, and then they put me in, so I nearly died, and then I was put into a 24-hour coma to recover. And then down the track, basically without going into it too much, I had a really hard time recovering and then going through PTSD 6 months down the track. And my valve was meant to last 10 years, and now it's lasted 2. Fast forward to January this year, and I had started to get out of breath and what I thought was maybe chest pains when I exercised. So I went to see my cardiologist. I went for a checkup at the beginning of this year and said, I think something's wrong. And he said basically as soon as I had my last valve surgery, my levels had started to rise within 5 days. So obviously the valve just didn't suit me, and apparently sometimes cows' valves, so biological valves, which is what I got, just don't work in young people, and they're not the best choice, but they give them to you if you're a girl, because if you have a mechanical valve, which is what I will have this time, is risky to be pregnant, so they don't like to give them to young women. So basically for the last 3 months I've been trialing warfarin, which is blood thinners, to see if that would help me before getting this surgery. So maybe they didn't have to. Basically, so for the last 3 months, every 3 or 4 days I've been having blood tests to see the level of how thin my blood is. And so obviously it hasn't worked. And you can't even drink on warfarin either, so I can't even drink my sorrows away. So on Monday I went to the cardiologist and found out that I'll have to have open heart surgery again in the next few months to give me a mechanical valve, and I'll be on blood thinners for the rest of my life. So yesterday I had a real, you know, why me day. That's how I kind of felt about it all. Like, you know, the feeling of knowing I came so close to not making it last time absolutely terrifies me. And, you know, seeing people and thinking, what if I don't see you again? Like, what do you say to people when that happens, you know? So the last few months have been really tough. And I guess the next few months will be even tougher. But yeah, I've got a bunch of appointments with my surgeon, and then a few smaller surgeries coming up in the next month. So I thought I would share my journey this time, and then my recovery afterwards, day by day, each step, to make it a little bit easier for me, and also for anyone else to go back on and have a look at if they're struggling and know that there's someone to talk to if they're going through a similar thing or anything like that. And you know what they say though, like, this will be my third heart surgery, so maybe it's third time's a charm and this one will do the job.